Thank you, everyone, for joining us this morning for the showcase with Christus Health. I'm going to go ahead and turn my video off. And um, Tony and Luis, if you want to go ahead and begin with your introduction. I'll just let everyone know my name is James Freeland with the Texas Veterans Commission. I'm an employer liaison, and joining us today are the recruiter and recruiter lead for Christus Health. Thank you.
Thank you, James. Appreciate that. So we're going to be presenting the PowerPoint ourselves then. So I guess I would share my screen. Is that what you want me to do, James?
Yes, sir. That way you can go ahead and go through the feed or go through the presentation while you're speaking.
All right, Tony. So do you want me to pull up the PowerPoint then?
Yes, please go ahead, Luis.
I'll go ahead and share my screen.
While Luis is getting that ready to go, my name is Tony Carizales. It is a little tricky. It took me a good while. I remember back in elementary school to learn how to pronounce that name correctly. So no hard feelings, James. Luis Sepulveda, my counterpart here. We are both managers in talent acquisition with Christus Health here in San Antonio. Luis is pulling our slides up now while he simultaneously shows you the beautiful Christus purple. There we go. There's Luis. But Luis is going to get us kicked off here. Hope everybody's having a good morning, and yeah, hopefully we will get you some information that's going to help you make this transition a little easier. We were there not that long ago. Both Luis and myself are military retirees. And Luis, whenever you're ready.
Okay, can you see it? Are you able to see the screen?
Yes, go ahead and hit that. Yeah, that right there. Down on the bottom, next to where it says 76%.
Down there on the bottom right where the notes are and everything. If you clicked up to the left, there's a little presentation. That one right there. Yeah.
Did it work?
And those of you that are just now joining us, welcome to the presentation today with Christus Health. This is the employer showcase. If you're not presenting or speaking, we ask you that you do not present your video feed or and please mute your mics until you have a question. But please feel free to go ahead and ask a question within the chat. And if you do have a question and you want to share a video at that time, that is fine. We just ask you to hide your video at this time, turn it off, so that way it'll prevent any sort of lagging through anyone's network. Thank you.
Don't know why. There it goes. Okay, so everybody can see the screen? Tony, yes. Are you able to see? Yes. Okay, great. Okay. Good morning, everybody. Thank you for joining us. Sorry for about the little technical issues we had there. So a little bit about myself. Excuse me. My name is Luis Sepulveda, also known as Seppi, because a lot of people can't pronounce my last name. I am a retired veteran. I served 13 years with the United States Marine Corps. And so my last 7 years, I was a career planner. And then I finished out my military service with the Texas Army National Guard as a recruiter for the last 7 years to complete my 20 years with federal service. So with that said, we understand, being a veteran, how difficult it is to transition and find job opportunities. So thank God now that there's a lot more ways to network, and hopefully, we do have a lot of positions. So as we go through this presentation, towards the end, we can answer any questions you might have. So these are some of the topics that we're going to talk about here at Christus Health. We're also going to talk about the DoD Skill Bridge program and introduce that for anybody that is on active duty and considering doing a Skill Bridge program. We'll also be talking about our mission and our locations. So we'll go ahead and jump straight on into it. This is our locations, and we call our facilities ministries due to the fact that we are a Catholic nonprofit organization. So basically, all the money goes right back into the associates and to the ministries, or other known as facilities and hospitals. So we have over 600 facilities throughout, not only here in Texas. So we have, of course, the San Antonio area, the surrounding area of New Braunfels, San Marcos. Also, we're down in the coast of Corpus Christi and the shorelines down there as well. We're also up in the northeastern part of Texas. So if anybody's up or knows of anybody in the Tyler area and surrounding, we are also in Louisiana as well. And we have a few ministries in New Mexico. So we are international. We do have ministries in Chile, Colombia, and also in Mexico as well. We're over 45,000 strong in our what we call our family, and we call associates as opposed to employees, because we truly believe in that work balance and that family culture. Our focus is really around the associates to make sure they have a really good experience working here at Christus, and to have that really good nurturing family environment. So it's something that, again, coming from the military, we're definitely used to, of course, having that camaraderie. We have that same camaraderie here at Christus. We have over 15,000 physicians. So we're pretty strong when it comes to having the manpower to be able to run our ministries as well. So our main mission is to extend the healing ministry of Jesus Christ. I'm sorry, did somebody speak?
I'm sorry. Yeah, real quick, I think you're sharing the wrong screen. Because I think you've already switched slides, but we're still seeing the original.
The original slide? Oh, okay. Let me see what's going on here then. So you're still seeing the original slide?
Yes, the Christus Health DoD Skill Bridge program, October 28th. Do you have multiple screens up?
I do. Let me.
So yeah, whichever one you're presenting will have a red border around it.
Gotcha. Okay. Do you see the full screen, Tony?
No.
It switched screens on me. I see what's going on. Nope.
Yep, because now it's showing your email.
Can you see the second one now?
Yes.
Okay, I'm just gonna leave it there so I don't mess anything up.
Yeah, we can just do it this way.
Okay, we'll just do it this way. I apologize for that. For some reason, it didn't. When it opened up in my second screen. I do apologize for that. Okay, so this is where I was talking about where where our ministries are at. So everybody can hopefully get a visual on that. Okay. So now you can see the screen, right, Tony?
Yes.
Okay. Apologize for that. So again, yes, back to our mission. Our main mission is to extend the healing ministry of Jesus Christ. And that is true and dear to our heart. We really feel, even with the SkillBridge program now that we're doing, we feel that we're able to not only extend that in the healing ministries throughout the hospital settings, but also in SkillBridge, now we get to extend that to our veterans coming into the program and being able to experience Christus. And so hopefully getting them to transition a little bit more into the civilian sector as well. As you can see, our core values, they really marry up with what we're used to in the military as well. So having that integrity, excellence, compassion, and stewardship are things that truly are our core values here at Christus. So I'm going to talk a little bit about the SkillBridge program. This is something that If you're still on active duty and you're looking to network and get your foot in the door per se at a company, there are a lot of companies out there that are doing the skill bridge program now where you can come in basically as an intern. You'll still be getting paid by the DoD. You'll still receive your benefits. However, your branch of service will allow you to come in and serve 180 days or less with that company and actually get to learn their culture, learn their database, be trained up on how things work at that company level. And also it gives the really good thing it does is gives a chance for you to express all your talent that you bring. So not only do they see that on a resume, but now they actually really get to see it as you work hand in hand with the associates. We try to give you the whole experience. So you would actually go in through and do orientation. You would be working the hours right alongside everybody else. And unless you really mention it, all the other associates, they have no idea you're on the skill bridge program. They think you're just another associate side by side by them doing the work. So some of our highlights, we are new to the skill bridge program at Christus. We started back in the 29th of January. And we finally got our first skill bridge associate on May 9th. She was a Air Force and worked in HR, and now she has transferred over and is a full-blown associate with Christus. So since then, we have 16 more veterans going through and doing the skill bridge program here at Christus. We've been able to hire on 2. We actually have 2 more in the pipeline that have already signed their offer letter, and they're just waiting to start their actual start date with Christus. And they came through the skill bridge program. So it really shows that the program works. They get to show their skills, and then the hiring managers have a better, a better understanding and more information to where they can make that sound decision to say, yes, we want to keep these veterans employed here, and then offer them jobs. As of right now, between now and January 3rd, we have another 11 more skill bridge associates coming through, and they're going to get the experience, the culture here at Christus Health. So if anybody is on active duty and would like to participate in the skill bridge program, also, or if you know of anyone that you have family members that are about to get out and would like to do the skill bridge program here in San Antonio and would like to get into the medical field. Now, we do hire clinical and non-clinical, so you don't have to have a healthcare background. And the good thing about the skill bridge program is we do have entry-level positions that we can get you into to get you that experience on working in a hospital environment. This would be the landing page to go to. So you could, if y'all want to take a picture of that, and then or just Google skill bridge at Christus Health, and it'll pop up, and you can go to our landing page. So you can put your information in there, and then we can contact you about the skill bridge program and go from there. I'm also going to go to the next slide here. This has our point of contact. So if you want to contact directly, again, there's my name, Luis Sepulveda, and that's my direct email and cell phone number. What we highly recommend, if you can email the general box. So this email right there goes. We have 2 other recruiters now working under just the skill bridge program to be able to answer any questions or any emails that come through that general inbox. Dan McKessie, he is newly promoted within our ranks here at Christus. He is the program manager for the military pipeline. He is in charge of the talent development. So basically his role is to connect you with the hiring managers and to assist you through the Christus experience. So we work hand in hand to make sure that you're getting that good experience, and also the hiring managers understand the program as well. So that concludes everything about the skill bridge program through Christus. At this point, are there any questions or concerns before I pass it over to Tony?
Hello, Luis. Yes, just one question came up during the chat. They want to know if it's possible, if we're going to be able to have the slideshow available to email out to the participants.
Yes.
Okay.
Yeah. would you like me to email to you, James? And then you can, do you have that? Or you can send me the list, or whoever wants it. I can definitely email to them directly as well.
If you send me the presentation, I'll email that out to the attendees. That would be great. And again, everyone, the video will be made available as well.
Thank you, James. Appreciate that. And I will most definitely email you the presentation.
Thank you.
Any other questions? Okay, I'm going to go ahead and pass it on to Tony. And Tony, I'll just keep on doing slides for you. So you just let me know when to.
All right. Thank you, Luis.
Yes,
Good
sir.
morning, everyone. My name is Tony Carizales. Just as Luis had mentioned, and I mentioned a little earlier, both of us are military retirees. I myself just hit the retirement list February of this year. So I was sitting in the exact same situation as many of you are in the room currently are. And more than anything, me and Luis are invested in this program and in getting veterans opportunities here at Christus because we want to help our brothers and sisters in arms more than anything. Of course, it is my job to get my recruiters to contact individuals and fill these positions. But more than that, like I said, absolutely, this is more of a personal endeavor for myself and Luis. We absolutely want to help every single person that this information is applicable to in the room. And I hope that you are getting something from this. Absolutely, the SkillBridge program is phenomenal. There are some timelines associated with that can perhaps make it not an option for you in your present state, wherever you are in your current journey. I began working with Christus last November while I was still on terminal leave. Like I said, I just hit the retirement list technically on February, and that was because of the whole pandemic situation. I had a massive stockpile of leave, so I was on leave for a good while. So worked out perfectly. Definitely a scary situation as the finish line gets closer and closer and closer, and wondering what's going to happen next. What am I going to do next? And we're hoping to bridge that gap and give you another tool to add to your tool belt and another option to explore as you get closer to your final date, whatever that might be. Next slide, please, Luis.
Tony, we do have a quick question that
Sure.
was requested. How far in advance prior to them exiting the military should they apply or check into the SkillBridge program?
I'll let Luis take that one. I don't want to
Okay.
give any incorrect information.
Yes, sir.
Yes, on that, as far as the SkillBridge program, the more time you give us for placement, the easier it is. I would, if you already know you're going to come in on the SkillBridge program, if you could start off at least 6 months prior to that, 3 months prior to that, that gives us a lot more time to get those placements done in a timely manner. So we're still going, like, again, because this is new to Christus this year, we're still in the development phase where we're contacting more hiring managers and educate them about the SkillBridge program. So once we have more people on board and educated about it and understand the program, we'll have more buy-in to where we can have, that'll give us more placement areas as well. Does that answer the question?
Maria, does that answer the question?
Yes, it does. Thank you.
Yeah. And we also have another question there, Luis.
Yes.
Is it available to spouses or soldiers only?
Yes, we do have, we can do the SkillBridge program for the spouses. What I highly recommend is going through the Hiring Our Heroes and doing the spouse fellowship program, because what they have is they're able to pay for 6 weeks to the spouse. So at least they would get paid for 6 weeks of training. And then we could hopefully look at hiring on the back end. But if they don't go that route, yes, we would be able to accept them on the SkillBridge program. It just wouldn't be paid through us.
Perfect. I'll send a link out for that as well. Or, Pamela, I'm sure you already have the link for that.
Any other questions?
So I'm glad that those questions came up. And as you can see, Luis is absolutely the subject matter expert for those particular programs, SkillBridge and similar programs like Hiring Our Heroes. Those are the opportunities that are there for individuals who are still currently serving. The opportunities that I'm going to be discussing, these are the positions that you would apply for just as any other civilian would go to our website, would apply online, would attend one of our hiring events. So this is a path that is available to you while you're on terminal leave. Like I said, I did not go through SkillBridge or any of the other programs. I wish I would have. Definitely lesson learned, and in hindsight, I wish I would have gone that route. It was a scary transition until I was fortunately found this position, and Christus has been nothing but great from the get-go. But these positions are available for you while you're on terminal leave. If you're already out, these are the positions that we have available for the general population. Absolutely. But as you can see from this slide, when we're talking opportunities here in San Antonio and the metro area, as well as New Braunfels, San Marcos, even all the way down to Corpus, all of that is what falls under the Santa Rosa Ministry umbrella. Just as you can see there, we have over 1,000 licensed bed, a number of facilities and specialty centers. These are the main hospitals that fall under the Santa Rosa umbrella, but there's a multitude of standalone facilities, standalone ERs, and similar facilities that we also are responsible for filling positions in within Santa Rosa. Our facilities are top-notch. Cardiac care recognized, just as you see there, from they received a recognition from the American College of Cardiology for treatment of heart attack patients. Kind of to put that in perspective, only 240 hospitals nationwide are given that distinction. Multiple awards for clinical excellence, senior care, always innovative. All our facilities are very known for giving absolutely great patient care. Magnet facilities. There's only 2 magnet facilities within the entirety of the San Antonio metro area. One of those being our Children's Hospital in downtown San Antonio. Again, very, very prestigious. That's something that the American Nursing Credentialing Center awards. Difficult to maintain that status, and that's why we're one of only 2, not just in the San Antonio area, but even bigger, one of only 10 in the state of Texas. Last month, Forbes ranked Christus among the best employers in Texas. San Antonio Express News, top workplace, consistently year after year. And this all ties back to those values within Christus: dignity, integrity, excellence, compassion, and stewardship. Probably sounds kind of familiar to some of us, but absolutely, there is a place for all of us, military members, spouses within Christus Santa Rosa. I think Luis and I are a testament to that fact. We have definitely found our footing here in Christus in a very short period of time, and our peers as well. Luis and I remark pretty constantly about how many other military members that we work side by side with, and how well we have done within the Christus organization. It is a very convenient transition, and I think a lot of you would find that similar experience. Next slide, please, Luis. And I know a lot of us, when we're thinking Christus healthcare, everyone is wondering, do we need to have a healthcare background in order to get a position here at Christus? The answer is no, but absolutely. Of course, that is something that we and every other healthcare provider is in tremendous need of. Those opportunities are always going to be there. This is just a snapshot of some of what we are constantly on the lookout for. Of course, registered nurses being at the top of the list, our LVNs, a number of tech positions, any sort of medical specialty that you may have a background in, that you have license you're in. We are looking to fill a position with your name on it. Absolutely. If you go to that same website that Luis mentioned earlier, careers.christushealth.org, all of our positions are on there. You can filter down to a particular credential, a location, a particular facility that you might want to work in, and you can really hone in on something catered to you, specific to you and your background. But outside of the healthcare opportunities, next slide, please, Luis. Obviously, Luis and I, we don't have a healthcare background. You don't need to have a healthcare background in order to get your foot in the door with Christus. So we have a slew of other positions that may be applicable to you and your military background. Materials management technician, that's for all our supply individuals in the room. And then we have so many other positions that absolutely are working within the facilities. You are side by side with the healthcare providers, but you don't necessarily need to have a healthcare background. And those are positions such as that patient access representative. We have unit secretary, a number of other administrative positions, talent acquisition, talent specialists, some of the realms that Luis and I are involved in. Those positions are absolutely available. They are there. Human resource specialists. I know of a few openings right down the road from me for any individuals with a human resources background. These positions are there. They're available. You see they're on the list as well. Chaplains. Of course, us being a faith-based organization, we're on the constant look for chaplains. So if we happen to have any military chaplains in the room, there's absolutely that opportunity to come right over to the Purple team, and we always have positions available for our chaplains. Next slide, please, Luis.
Tony, on that note, as far as the other opportunities, we do have a gentleman that's asking about an emergency management position, continuity business, disaster mitigation. And I was doing a quick search within the career page. I don't see anything off the top of my head that related to that, but perhaps you can speak on it.
Something that's specific, yeah, I would really like to see a resume and what the credentials look like, the background, and then if we don't have anything right along line with that, then definitely we could present some options that would be applicable for sure.
That's one of the wonderful things I've learned, working with you and Luis, is that you're so easily to work with, but we can present you with a veteran, with a specific skill set, as we mentioned before, a lab technician, but that you may not be hiring for a lab technician, or perhaps they want to take a break and look into another sort of field that's some related soft skills and some of those hard skills they may have obtained. So I think that's great, Tony. Thank you.
Absolutely. And yeah, I would ask that all of you, as you make this transition, please remain flexible. Do not get your head wrapped around, well, this is what I did in the military, so this is exactly what I need to do, and this is the sort of position that I need to assume for the rest of my working years. Be flexible. If there's something else that you want to delve into, try and get your foot in the door with that. Like I said, absolutely, I want my guys to be able to contact you and fill these positions. But at the end of the day, more than that, whether it's with Christus or some other organization across the street, I just want everyone in this room, as my fellow brothers and sisters in arms, to find something that's going to make you happy long term. But absolutely, this is one of the places that can get you there.
Thank you, Tony. And we do have a couple of other questions if you have a moment. One of the questions is, they want to know, how do they send their resume for emergency management? And on that note, I'd say if you're already working with a career advisor, go ahead and work with a career advisor to make sure the resume is, up to a certain standard that they would want to be able to see it. And then we can get that over to the recruiters. That might be the easiest way to do it. You think, Tony?
Absolutely. Absolutely. That would be the best route to go.
And if you're not working with a career advisor or a family career advisor like Pam, I would suggest going into the local workforce center and or just getting with us after this, and we can connect you with the right career advisor.
And please take advantage of all those opportunities to assist you with your resume. I know when I was making the transition, my resume read very much like an NCOER. That's not the way that it should look. And after some decades of military writing style, we might need some assistance in translating some of this material to make sense to civilian employers and recruiters so they don't just pass us by. I did see a question pop up there. What is a patient access representative? So a patient access representative, this is a position every single one of us in this room has interacted with a patient access representative. But when you walk up to that front desk within that medical facility, it's that individual that you are making contact with that is setting up the appointments, maintaining the flow within the facility, within the clinic. That front desk personnel within the healthcare facilities, that is generally what's referred to as a patient access representative. That particular position as well, the only thing that is required is a high school education. Everybody in that room, of course, has that. There's a number of other opportunities where the experience piece does not necessarily have to be healthcare related. Patient access representative only being one example. Unit secretary is almost synonymous with that particular position, and which ties into these on-site interviews that we have every single week at our facilities. Every single week at the Children's Hospital. Every Monday you can walk in there. Every Tuesday at our medical center location on Babcock. Every single Wednesday at Westover Hills, like clockwork from 10 to 1. If any opportunity shows up on our website, comes up on your radar, however it does, you can walk in and request to interview for that position if, of course, you are meet the minimum requirements. This is a great way to get your foot in the door, even if you just want to get some real world repetitions in as far as your interview skills, because it's been a while for some of us. It was absolutely decades from the last time I had to interview for a position, which probably would have been at some call center or something when I was a kid. But it had been a long time since I did an interview. So absolutely, I can't stress enough. Please take advantage of all those opportunities to do those mock interviews, to get assistance on your resume. Like I said, walk into these events, go in there with a resume, say, hey, I saw this on your website. I'm here to interview for this position. And those recruiters on site will make sure that any other applicable opportunities that they have within their facilities that they're trying to fill, they're going to get that hiring manager on the phone. They are all on standby during these hours between 10 to 1. All we do is ping them on Teams, say, hey, I got this individual I think would be great for position X. Please come down. Let's get this interview done. And walking out the door that day, we could have an offer letter ready to be signed. And it really can be that easy. So please take advantage of these opportunities, these walk-in events. Like clockwork, every single week you can count they are going to happen.
That's amazing, Tony. Thank you.
Absolutely. Good opportunity to get some free purple stuff too. So there's also that as well. But last slide, please, Luis. So this is my contact information here. Absolutely, going through James with your resumes is certainly going to be a better way to filter and get some immediate feedback. I am the manager for talent acquisition here in Santa Rosa. So I don't want anybody's information to get buried in my inbox. Absolutely, please go through James. If you have any individual questions, even if it isn't about working with Christus. If you just want to pick the brain of a couple of old vets as well, feel free to reach out to me. Like I said, we absolutely have personal interest in this and assisting James and his team in getting you all where you need to be now that you're making that transition. And truly from the bottom of my heart, wish everybody the best of luck. And what questions does anybody have?
We do have a question, Tony. Somebody is asking, that's Fred. He's asking, if he's currently working as a career counselor or have worked as a career counselor at the workforce center, is it possible, in the workforce, is it possible that would translate into a talent specialist?
Absolutely. Absolutely. And talent specialist, I don't know if you're familiar exactly with what that position is. A pretty obscure term that outside of Christus, it's probably not widely used, but it is essentially the individuals that bridge the gap from the recruiter to the hiring process and to getting that individual working on the floor within one of our facilities. So once our recruiters get the offer letter completed, those talent specialists are the ones initiating the background checks, verifying licensure, verifying previous employment, setting up the health screening, so on and so forth, all the pre-boarding, onboarding steps that are required, checking all those blocks to make sure that we didn't miss anything during the initial process when recruiting these individuals from the time that they hit the floor and begin their journey with Christus. Absolutely, the experience as a career counselor would be applicable to that position. So there is an opening. There is an opening. Without even having to reference the site, I know it's out there.
I see it on there right now. Yes, sir. Yeah. And just to understand, that's somewhat like a HR coordinator as well, right? Someone that's coordinating those pieces between the specialists.
Correct. There is an HR position as well. I want to say there's one within the children's hospital, but yeah, HRBP positions, they're out there as well for sure.
Hello, Tony. Hello, Luis. This is James Wilson. I am out at the Corpus Christi area. I am a fellow veteran employer liaison, working along the same frames as James. So my question is, I'm glad you mentioned that. So one of the questions that I always get, and always my standard question when I'm working with the veteran career advisors here is, I know it varies, but what is the guesstimated time frame if James Wilson wanted to become that patient access representative? Because I know positions may vary, but what is the guesstimated time frame when I put in the application to what you just said, going through the backgrounds, licensing, verifications, the whole nine, just a guesstimated time frame of the process? Because we do get those questions asked of us from the veterans that we work with.
I would say 3 to 4 weeks is a realistic expectation. And I know that sounds like a long period of time, but one of the things that does require that we present that as a realistic expectation is the fact that every associate must begin their employment journey at the beginning of a pay period. So depending upon where we're falling in the month, so much is going to be dictated on when is the next new associate orientation class. The recruitment process itself is pretty streamlined and will not take that long. So if Luis applies for a particular position today, within 48 hours, a recruiter will reach out to him and do what we refer to as a phone screening. Just get some basic information from him, off of the information that we already have available from their application. Once that determination has been made after the conversation with the potential applicant is, okay, did he check all the boxes that I need to be able to present him as a suitable candidate to the hiring manager for this position? All of this should happen within the first 72 hours from that individual applying for a position. Now I've passed the word on to the hiring manager, said, hey, I got Luis here, I think he's going to be great for this position. I already talked to him. Here's some notes pertaining to our conversation that I think might be some information that you might want to hear prior to you potentially interviewing him. That hiring manager also has that expectation of 72 hours to provide us with appropriate feedback. Yes, I want to interview this individual, or no, I do not, and this is why. That communication will come from the recruiter, whichever side of the fence that hiring manager is on. If they do want to interview that individual, absolutely, we want to get that scheduled and set up. If they don't, we also want to relay to that individual why they chose not to pursue them. And either way, that communication will be made to the candidate. We get the interview done. That day, the hiring manager should let us know, yeah, we want to go ahead and hire Luis. That same day, the offer letter, the compensation conversation will be finalized. And from there, depending upon when that next new associate orientation date and where we are on the calendar as far as meeting our deadline for that next date, it's always going to be on a Monday for new associate orientation, other than potential holidays forcing us to push it to a Tuesday. But that's generally the ebb and flow for that timeline. Might have got a little too carried away on that conversation, but
that's
it
fine.
in a
I'm
nutshell.
glad that you mentioned that last part as far as whatever the results, whether either a yay or nay on the hire, because
Absolutely.
again, that is another when we say, hey, apply to this position, and then we follow up and say, hey, have you followed back? And like, no, I haven't heard anything in about 2-3 weeks, so we don't know if they were
Worst
hired
feeling
or
in the
not.
world.
And we leave, and the veterans
Yep.
get left hanging. So I'm
Worst
glad you
feeling in the
mentioned that.
world.
Yeah.
Like I said, I
Yeah.
was right there, and that was absolutely the worst feeling in the world, especially having an interview, thinking it went well, and then getting ghosted.
Yes.
And it's like,
Yes.
okay, I didn't get it, but let me know why. Let me know why so I can work on that for the next time. Absolutely.
All right. Thank you very much.
Yes, sir.
That's the reason why I don't normally apply in the month of October, because you're expecting to get ghosted anyway, right?
True. Good to hear from Corpus
till
too. That's my
November.
hometown.
All right. All right.
And I believe that's where we're going to try the next event is the Corpus Christi region. So nice. Are there any other questions that are coming up? I'm looking over here. Besides SkillBridge, does Christus offer any internship opportunities?
Besides a residency program, I'm trying to think of any other internship programs we have. We do have volunteer programs. You can go in there and volunteer for certain things. That's something you would have to apply to that volunteer program. They'll do a background check, of course, and all that. And if you're selected, then you would be able to volunteer as well. I do want to say this. I just want to add a little secret, throw a little nugget out there, as Tony says. So once you start with Christus, and maybe I shouldn't throw this little secret out there, but you only have to be with us for 6 months before you can start looking to promote within. 80% of our executive positions have been promoted from within the company. And that's truly, we pride ourselves on that because we homegrown our own executives, the managers and so forth. So if you're looking for a position and you're like, I really want management, maybe apply for something a step lower than that just to get your foot in the door and then sell yourself. Prove to everybody else, hey, this is my worth. This is who I am, and this is what I bring to the table. The best time to look for a job is while you have a job, right? So while you're in Christus and you start working there, you start getting learn the culture and how everything works, the whole system. We always have an internal board first. So most of our jobs get posted on the internal board so we can promote within, especially the higher positions. So we're always looking to fill entry level and so forth. But if you're looking for those higher paying jobs, get your foot in the door, and then every 6 months start looking to see where you can promote into. And Christus is very big about promote within. If they see your talent, they might even reach out to you before you even hit that 6 months.
Oh, that's
So I just
great.
wanted to share that information.
And I know you guys are always active at the TAP program here at Fort Sam, and that's excellent.
Well, Luis, since you opened that door, then my question would be next would, if there was a position you're currently working at Christus there in San Antonio, but like Tony said, he's from Corpus, how would I guess a transition for relocation be from San Antonio to Corpus? Would it be a hire within if that position was open, or how would that work?
So not like the military, where you have to get a conditional release. And
Right.
that's recruiter talk, right? You don't need a
Exactly.
conditional release, nothing. All you got to do is put in that transfer. And if it's a higher position, it's a promotion, and you get accepted for that position, then that transition is pretty smooth. You just got to figure out when your last date's going to be and when the start date you're going to start that new position is going to be. But yes, Christus does not hold anyone back. They're very big on if you feel that you can fill those roles, they highly encourage you to take those roles, because we do want leaders. We want leaders to fill these gaps. And especially if you've already been with Christus, you already know our culture. So it's easier to promote within. Since I do have you on the line, Mr. James, I'm sure, do you know Ricardo Garcia from the TAP organization over there in
Yes,
Corpus?
I think I do. Yes, I know
Yes,
some others.
he is
but
our point
yes.
of contact for the SkillBridge program for Christus as well. So
Okay.
hopefully you can connect with him. And if not, I'll give him your name to connect with you as well, sir.
Most definitely. Thank you.
Did that answer your question?
Yes, it did.
Hey, do we have any other questions from the field out here? Let's see. Now's the time to ask the questions. We're live. All right. We do have someone's got a hand up. Yes, go ahead. Vic.
Okay. Victor, so I'm the one that asked the question about the emergency management. So I just didn't understand like the process of how to apply for it. I know you guys mentioned if I was working with the career counselor, that means within the Christus organization or with the Texas
With the Texas Veterans Commission.
Okay, all right. So I am working with someone, I believe, but then okay. And then one question for Tony, if you don't mind. You said that if there's not a position as the one that I'm asking for, the organization is willing to maybe find a fit within the realm or within the scope of those duties and responsibilities, such as, for example, this pandemic that just happened, right? So everyone was caught, with their pants down. So how do we continue to see patients through that process, right? So we implemented the all this Microsoft Teams and all this other social media to continue to do business. So that's the type of experience that I can bring besides natural disaster or any type of human or natural disasters.
Absolutely. And I have no doubt that there will always be a need for an individual with that skill set. I do want to go back and just mention that all of that experience, whatever education that is associated with that, all of that is going to be applicable and useful and an absolute resource in other opportunities that you may not have even thought to explore. And that's absolutely where we can assist you. James can provide us with some additional information, looking at your resume, being able to present some other opportunities. Again, everyone in the room, just please do not wrap your head around, hey, I need to move into something that's going to mirror almost identically what I was doing in the military or for the past X amount of years. There's so many opportunities out there. Our journeys in the military, all the spouses in the room that were along for the ride as well. Our skill sets are unique. They have truly made us adaptable for a number of positions. Don't sell yourself short. There's so many things that we qualify for. Like I said, Luis and I came in to Christus both as recruiters, and the difference between our work ethic and some of our contemporaries is immediate from the second they open the package, and that's going to speak to everyone in this room. We just need to get our foot in the door somewhere and be able to show everybody what we can do. Absolutely. But we can definitely help you, sir.
We do have a question from Pam. Oh, go ahead, Vic.
No, I was going to say, yeah, thank you for the time, and thank you for the information as well.
Yes, sir.
And Pamela Smiley, you have a question?
I do. My question that I posed earlier when I asked if there was a way to submit your resume without specifically applying to a particular position, my reason for that is a lot of times when you look at the positions online and you read through the description verbiage, it can be sometimes confusing because the verbiage may be different than a position that I may read somewhere else. And so it's sometimes you're not sure exactly what that position entails. And so is there ever a situation where you all take a resume and say, well, you may not fit here, but let's look over here because we may have another position where your skill set may fit better. And that's why can I submit my resume without applying to a specific position?
Understood. And the answer is yes. So you can go to the Christus Careers site and you can create a profile on there and upload your resume on there. However, full disclosure, eyes will not get on that resume until it is associated with a particular position. And this is one of those instances, and this would be a perfect scenario for you, ma'am, to attend our walk-in events. And this is the format, and you are one of the individuals that these walk-in events would be perfect for, because that is absolutely what that on-site recruiter is there to do. You walk in the door, you have your resume, you hand it to them, and you let them know, hey, give me what you got. What can I interview for right now? That recruiter on site will be able to set you up with an appropriate job opening within that facility and have the hiring manager walk from right down the hall to interview you on the spot and potentially walk away with a new job.
Okay, perfect. Thank you so much.
Yes, ma'am.
I just want to chime in on that.
I feel like I'm yelling.
You're good, man. You're good.
Right.
I want to chime in on that. Something that I learned at an early age when I was applying to other jobs and having that, when I went through my transition and trying to find jobs and just had a hard time, something that somebody told me one time, do not disqualify yourself, let somebody else disqualify you. So if you think you don't fit for that job, but you might have some similarities and it's questionable, apply for it anyway. You never know. You might be the lucky one to get picked. Maybe nobody else even applied for that job. So don't disqualify yourself. Let somebody else disqualify you or tell you, hey, maybe, work on your resume a little bit more. Maybe change the verbiage up a little bit more or something like that and get somebody's advice. But definitely put in for any job opening that you feel that you are qualified for or think that you could do. Apply for it, please.
Okay, so two other questions that just came up. Thank you, Luis. Two more questions that just came up were, one, how long do the resumes stay in the profile? And I think you kind of answered that. If it's not associated to a specific job, it's kind of just sitting there, but does it drop off after a certain period of time?
It does not. However, of course, if the resume on your profile is 2 years old, and you do associate it with a position down the line, once that recruiter does make contact with you, they are going to ask you for an updated resume. Absolutely. But it will not drop out of the system, no. And I do see the other question there about benefits. James, I'll send you a PDF version, just kind of a snapshot of the benefits that we do offer, but absolutely great benefits package. Of course, those of us who are military retirees, a lot of us have the opportunity to not have to worry about some of the costs associated with those. So that's great to have in your back pocket as well. But our benefits package at Christus, top notch. I'll send James a summary of that information to distribute to everybody.
That'd be great, because I was just looking when I saw the question, I went directly to your benefits portion of the site, and I think the PDF or something would be great, and I can send that out to everyone that's attended this event today.
I got a real quick question. Again, on the resumes, I know you, of course, look at the resumes, but how do you guys like cover letters?
Honestly, I would say cover letters, I think across the board in recruitment, this question has come up pretty consistently.
And that's why I ask.
I would stay away from cover letters. Anything that you want to say, it should be, as far as a narrative, clear and concise, and included within the summary portion of your resume. I don't see cover letters having much benefit in the current workforce. I don't.
It is an old school thing. Yeah.
Especially, you know, when we do have a recruiter going through hundreds of resumes on any given day, we want to make sure that they get our eyes on the actual meat, the bulk of the information. Yeah, we don't need a cover letter. No.
Thank you.
And then we have another question. As far as background, I think we discussed that once during our meeting, but you know, I'm pretty sure it's a case-by-case basis, depending on what it is, the seriousness of it, the type of charge it was, and how long it has been, right?
Absolutely.
And you said, you know, don't disqualify yourself. You know, apply and discuss
and absolutely, just as James is mentioning, that there is no cookie cutter answer to the background information. Unfortunately, it would absolutely be a case by case situation. But you know, up front, yeah, if there was something in particular, you know, in that preliminary discussion with the recruiter, they may be able to give you some insight off of previous experiences with individuals, and just be able to set some expectations for you. But again, until something like that is actually initiated, we would just have to wait and see. Absolutely.
And I could tell you that, you know, what they're going to do is they're going to look through the SAM registry, and, you know, because it's a healthcare field, they're going to look through the SAM registry. If you've ever, you know, committed some sort of insurance fraud, or if you're a nurse that, you know, your license, you know, was suspended or something like that, it would come up during the SAM.gov background check portion of it, correct?
And even along those lines, absolutely not an automatic disqualifier. I am not a nurse, but after working with a number of individuals in the field and recruiting for them for years and years, it does seem, if you're a nurse long enough, at some point in time, you might have a stipulation on your license. It's going to happen. It is not an absolute disqualifier. Things happen. It is absolutely case by case, depending on what the situation was. What the thing from the get-go that we're concerned about is, right now, is your license active and unencumbered, and we will proceed and get you to the background check.
That's great. Thank you.
We have a really good HR team that, if that situation comes up, when it comes with the background check, they make that decision. So the HR team will send that up, and they're the ones that make that ultimate decision whether we can move forward or not with that applicant.
Are there any other questions from anyone in the field? Again, now's the time to ask. We're live. But if you don't get your question asked here, you can always, you know, reach out to your career advisor or family career advisor, or, you know, walk into a center if you're not already working with one, and get connected with us. And as I said, you know, there are those days where you can have the walk-in interview as well. Go ahead.
I'm
please.
sorry, Tony, you had mentioned a position for talent acquisition that you knew of. I'm the one that had the question about being a career counselor for the Texas workforce. You said you knew of something here in San Antonio, possibly?
Talent specialist. So
talent specialist.
Talent specialist, little bit different from talent acquisition. Absolutely works side by side with one another. But yeah, if you're looking on our website, look for a talent specialist position.
Okay.
I think James will be able to assist you with that. I know he was looking at that a bit earlier, but it's definitely there. And it would definitely be in your wheelhouse as far as your career counselor experience.
Spectacular. Thank you.
Yes, sir.
Fred, with that experience that you have, we do have a department called talent development. And they're the ones that work with development associates and also the hiring managers. So if you have that kind of counselor background, that would be another department to look into, is talent development.
I appreciate that. Thank you.
And
James,
we do have another question from Lori. Yep.
Yes, thank you, James. And thank you guys for having this showcase. I do have a question that is a piggyback off of the conversation that just took place between Tony and Fred. Are any of these positions that you guys have, whether in the talent or acquisition talent specialist positions, the development positions that Lewis had just mentioned, any of those remote by chance? Do you guys work remotely?
So let me talk on that one a bit, Luis. And I know there's a little apprehension there. So it is also a ever evolving situation within Christus right now. So for example, our recruiters, our talent specialists, and a couple other individuals are currently in a hybrid schedule right now. And that is always something that is being revisited as far as going back into the office full time. Fully remote positions, we do not have available. We do have a number of different departments currently working hybrid schedules. Truly remote, we do not have.
Okay, thank you. No, I just had a conversation with a veteran yesterday, background in recruiting, but because of where he resides, which is up in Canyon Lake, he's really targeting like a remote type of talent acquisition, recruiter type of position. So I just wanted to throw the question out there, and who better to ask than these two recruiters right here giving us all the great info. So
absolutely. And
Thank
you know,
you.
when we're talking about a hybrid schedule, you know, making a drive a couple times a week, I mean, it might be something to consider for sure.
We also got one quick question that's piggyback on a little bit about that cover letter. We have Mr. Victor Barnes, who would ask, would a letter of explanation would be preferred? Would a letter of explanation be preferred?
I think this is going back, if I
That's
recall.
on the background. I mean, that's on the background, correct? When we're looking
Yeah.
at letter of explanation.
Right.
Right.
So again, that situation, if that is something that would be required at the time of the background check, to get the wheels turning on that prior to that background check, you know, with the recruiter or with the talent specialist or somewhere prior to that process, yeah, unfortunately, we wouldn't be able to do much with a letter of explanation. That would, again, just be a case-by-case situation once the time did come. And just as Luis mentioned, if we do have circumstances that we know may hinder the background process, we will loop in HR and say, hey, here is this individual's particular situation. Do we proceed, yes or no? And using their experience, they are able to shine some additional light on, yes, we can proceed with the background investigation because we do have some expectation that we will be successful in having this individual successfully go through the process, or no, this is something we will pump the brakes on at this point because we do know that given the circumstances and what was involved, that this probably would be something that we would not be able to successfully employ this individual.
Okay, and then we do have a few more questions here. I'm not sure I understand this one, but somebody is asking, is it possible to get a list of the employers? Can you please let me know what you mean by that? We only have one employer. It's Christus Health that's presenting today. That's coming from Lorenzo.
Yes, good morning. So I'm seeing a
morning.
lot of other employers from other, because I work for a nonprofit organization that helps homeless veterans find employment. I'm a case manager, but I'm seeing some familiar faces as of right now that are employers or recruiters for employment. But I'm just trying to see if there's any other employers out here that one are background friendly to our veterans, because like I said, our veterans are unemployed and a lot of them have a background, and I'm just trying to get that as soon as possible so I can reach out to those recruiters to see if we can do something in regards to the veterans.
Okay, for something like that, if there are any recruiters on here that would like to share their information, please feel free to put that in the chat, your contact details. Thank you, Lorenzo. And then we also have Lori was just commenting on that. Do we have any other questions out there? Again, we're live, and now would be the time to ask questions. And there's no bad question. The only wrong question is the wrong time. All right, if there are no other questions, and Luis, Tony, if you don't have anything else to add, we can go ahead and conclude the meeting at this time. And once again, this is going to be shared through our networks. It's going to be available on YouTube and through your career counselor, career advisor. You can view it another time as well. Thank you, everybody, for attending.
Thank you, everyone. May God bless y'all in your journey, and we look forward to hearing from you.
Thank you.
Have a good day, everybody.